Welcome everyone. Obviously, I'm presenting today from the Medtech evolution perspective, or the Medtech product itself, for the MT2 PenCat utility. So everyone can, I dare say, see my screen quite well there. So we'll just move on to the agenda. Okay, so today, obviously, we've got some core focus items there. I want to briefly touch on, obviously, the practice incentive program, so the PIPQI itself, and just give an overall sort of high level on that. Then going into the utility itself, and the two main components there being the Medtech mapping and the extraction tool. Following my time will obviously be Matthias, where basically he'll go into how we extract the data that we've mapped, or the eligible data set that we've mapped from Medtech, and push that out via an XML format into the Cat4 software. Okay, so PIPQI. So basically, this is the incentive, is a payment for activities that support continuous quality improvement in patient outcomes and delivery of best practice care, which general practices enrolled commit to implementing these in their role of managing patients' health. Improvement measures allow GPs to understand which patients may benefit from preventative treatments or may need a recall to ensure effective management of a specified chronic disease. Thus created the collection of the de-identified 10 quality improvement measures. So on my screen there, you'll see what they are, listed from left to right, top to bottom. So obviously you've got the proportion of patients with diabetes with a current HbA1c result, all the way across there through to the end there, where it actually talks about patients with diabetes that were immunized against influenza. And just going into this, obviously what I want to show everyone is the process in which the PenCat utility sees and correlates the eligible data set and the classification and medical screening terms that we are able to view in Medtech, and how that integrates into the Medtech utility. So they're all the PIPQI measurables. So there's the Medtech PenCat utility, and I mean, it's a pretty high level picture there, but what I just wanted to show everyone was, I'm sure everyone's used to using Medtech, and those that are on Evolution software. Obviously, I just wanted to point out that what we've done in order to ensure that we can run through our quality auditing testing and make sure it's compliant before production release, was to ensure that we set up a group of test eligible patients. And so the way that the utility operates is in twofold. So you basically go in and make sure that you've got the relevant patient on the pallet. You go to the utilities area, drop down box there, scroll down, and then click on the PenCat icon. I don't know if these are a bit small as far as the little snapshots we've got here, but we've got basically the two main components of what we have as far as the PenCat tool. So we've got the mapping tool and the extraction tool, both of which obviously play their role. And the core component for general practices is to really focus on the validation detail that goes into the mapping tool itself. So the mapping tool, I sort of pointed a little bit about the terminologies and the like that are used, and obviously this isn't all too dissimilar to how everyone uses Medtech. So what I'll do shortly is show everyone just one of the measurables, or two of the measurables actually, and go through that sort of process and how you would validate that data if you were prior to running the extraction tool. So I just wanted to highlight, you'll see that on that particular screen on the left-hand side, obviously the first quality improvement measure is proportion of patients with diabetes with a current HbA1c result. You'll see on the left-hand side there that we've got a whole bunch of predetermined fixtures there. So you can sort of see that they're already set up against what will be validated as those improvement measures in PenCat. So the left-hand side is the PenCat item. The Medtech screening term is the same term that we still use throughout the Evolution software, and then you've got the evaluation measurement. So I just wanted to highlight that. So I wanted to go through a couple of the quality improvement measures and just get everyone a clear understanding. I know everyone would have seen these in the past. So I know that people do understand about the patient classifications. So obviously, what I was just pointing to in this particular slide is that we can map obviously using ICP-2+, diabetes, diabetes 1, or diabetes 2. And you can sort of see the different in the classification screen there. So the validation of that is the code. So if you have a look at the HbA1c value under the code fixture, you'll see that it's noted there under the time. And I suppose from that end, I just wanted to highlight that that's your validation point prior to going into the PenCat utility. And you can also just see the details of how you can do that in the form of a screen itself. So this particular, so then from there, obviously the standard workflow would be you validated that, that's already set up, and you've sort of confirmed that you're comfortable with the screening term. So from there, we basically, go in to the PenCat utility, open up the mapping, and just do that validity check or sanity check to ensure that the right parameters are selected, and then you can press save dependent on obviously the data set that you're viewing. I put a note there that we can run the extraction tool once validated, but across the board, I think that's a pretty common consensus, and we'll talk about how to extract the data in a final way post this walkthrough. Now, Matthias will touch on this, but I just wanted to quickly show, and I'll go through this in the extraction shortly. Obviously, you've got that particular tool that's used for the Cat for PenCS. I just wanted to show that, like, after you've completed your extraction, it then exports an XML. This is the compliance authority or the PHN that will review that. And it's just about the understanding on what actually is demonstrated. And Matthias will go into that in a more in-depth level. So I just wanted to show just a snapshot of that, this being the standard walkthrough. It's just understanding the quality improvement measure itself, validating it to make sure that you're comfortable with the classification, and then saving that in the mapping tool to ensure that you can extract that particular parameter or that data set. So I just wanted to go through the same thing again for just another sort of one of the other quality improvement measures there. So obviously we've got, I just picked a random one in number 9. So that's a female patients with up-to-date cervical screening. You'll sort of see there, similar type fixture where you'll see under the code classification down to new screening that it's carried there as a HPV test. Again, that's the screening term. So that's your validity check. And once again, you'll see that it's already pre-confirmed the data set there. So you'll see on the left-hand side, it's selected as yes, as opposed to all the other parameters there. And then you've also got the screening term in the middle function there, and then the pre-selected measurement. And again, that is obviously the PenCat side of it. So the Cat or the PenCS tool side of it, again, it's just slightly different but the same type of workflow where you would import it and basically show those results in the necessary screening tab. All right, so the extraction tool itself, so this is the second component of the software or the utility tool itself. So you've got multiple options there So I look towards the sort of left-hand side underneath. So first and foremost, the extraction directory. So general speaking, in a general GP, my understanding based on the sort of data set and the amount of patient data that's collated in most general practices, you know, given the amount of that is probably going to rely on how much you want to be able to, you know, run this extraction. So my general rule of thumb, and that what we've used in the test environments, would be to do this in an after hours capacity. And dependent on the amount of patient data and the amount of data you guys want to review in those measurables, you know, can take up to sort of, you know, dependent on the size, so an hour, 2 hours or so. And it's just really something that the tool will be run in the background and then save to that particular directory there. That goes into a bin folder in PenCat, but at the same time, I guess you can change the extraction directory to wherever you want. If you have it on a secondary server, or you want to have some storage device area there, that might be useful. Just underneath that, you've got the extraction options. I'm sounding a bit hoarse already. The extraction options, where you've got the active patients, and then you can also include all patients, so you can include inactive patients as well. And then on the right-hand side is obviously the run option. So you'd be pressing extract data, which whatever parameters you write. The idea of the test function is that if you want to just have a captured data set, or you want to do a test phase, you can do it for 200 records or so. And then obviously you extract the data from there. And that's just a snapshot there of what I just explained. It sort of goes to that bin folder on the left-hand side there, and then from there, you know, we import it into the PenCS tool. All right, so just the last point before Karen takes over again is just that obviously, you know, this is obviously a new tool that we've just completed all of the beta release review and send the feedback on. So I just wanted to put a note, and obviously there'll be further discussion after this, but the tool itself is available via, and it will be post this webinar release via the website and via our support centre, including our Insight Support Centre, as well as I've just put a note there that there's a functional requirement for the version release of Medtech Evolution. Yeah, so it needs to be a minimum release of 10.4, and then also, you know, or the later release, which is about to be released actually, of 10.4.5. So it just needs to have a minimum baseline of 10.4.4. All right, Karen, that's it for my portion on PenCat. If you wanted to.
Thanks so much for that, James.
No worries.
I'll just introduce Matthias. He's the Quality Assurance and Training Manager for PenCS. Matthias has a degree in nutrition and a postgraduate diploma in information technology. He has worked in public health, health information and IT systems training since 1997, initially working in the public sector in the Northern Territory and Far North Queensland. He's been providing training for PenCS software users across Australia since 2005, so we're very lucky to have him today. He has worked on consultancy jobs in the Pacific on a number of public health, health information related jobs, and has a keen interest in data and public health. He's responsible for the user guides and other technical documents, training content and clinical quality assurance of the CAT Plus suite. So thanks so much for joining us today, Matthias, and sharing your expertise.
Yeah, well, thanks for having me. Thank you for the introduction. I sound very old when I hear all of that, but yeah, anyway, that's live. So I'll can you see my screen already? I think you do.
We can, yes.
Yes, okay, great. So after James' sort of more technical presentation, I obviously have some technical parts, as in how do you actually use Cat4 in particular in the context of PipQI, but I just got a couple of slides to go sort of over the more introductory. There's me. Hello, welcome for everyone. I'll quickly go past that. And just a quick overview. So yeah, obviously Medtech and Cat4, how do they work together? And I think most of that was covered by what James has showed you in terms of how the setup works, the mapping, and also the get the extraction started, but I might refer back to that a bit later on. Then of course CAT4 and PIP-QI. So with the new mapping or the new functionality there, and I assume there'll be some more data items that are now being able to pulled out. So what can you do using the tools, in particular CAT4, and then just in general PIP-QI and improvement measures in CAT4. So we, obviously there's this new extractor to create the data file. CAT4 uses for reporting. So the process is kind of couple of stages. You have the mapping done in your Medtech, you have the extraction done in Medtech, and then CAT4 can read the data. CAT will be able to upload this data file after the identification to the PHN. So that is, of course, the one of the conditions of being eligible for PIP-QI. You're submitting that data set. And yeah, the mapping I've already mentioned, I guess. So that's that's that process that James was showing. The data upload from CAT4 at the moment is a manual process. Manual as in you actually have to click, maybe 2 clicks, but I'll show you that once we get out of the slides. So it's fairly straightforward. And there's actually a first step before the upload. You need to de-identify the data, and only then can it be uploaded. If you by any chance try to upload non-de-identified data, it won't work, it will be rejected. The receiving end, PATCAT, the aggregation tool at the PHN, cannot receive non-de-identified data, so there's a bit of a safety aspect there. And I don't expect you to read all of that, but it's just a model how you can submit the patient level data to the PHN. So there's the users at the clinic, the data is extracted, it's de-identified, it then is uploaded to the PATCAT at the PHN. It is checked in terms of PIP-QI compliancy. There is an email reminder system that the PHNs are able to set up. So they can send you an email receipt to say, yes, thank you, we received an extract for this quarter. They can also send you a reminder, which will be sent on the first day of the last month. So in this case, 1st of October. If you haven't uploaded an extract by then, you will receive a reminder if your PHN has set that up. And then the rest is sort of more what the PHN has in their PATCAT to look at. And this is what James showed already, so the 10 improvement measures. I don't think I have to go into any detail there. And then just wanted to show you some, so this is not released yet. We only received the details for the 10 improvement measures, like the actual computation and analysis sort of details quite late. And it's currently being tested. I think we're good to go for the next week or 2 maximum, but basically it also depends a bit how you got your license for CAT4, because if the PHN has provided you with a free license, it depends if they again have purchased this particular module. If not, you won't see these, but I will show you today for a couple of resources on how you can do the cost check against those 10 improvement measures yourself without any new releases with the current version of CAT that you have installed now. And but I just wanted to show you what is coming anyway. So it should be in September. That's all I can say at the moment. But basically, we will have a tab, a CAT report for each of those individual 10 improvement measures, and they are exactly broken down into the categories that they want and give you the answers that you need for the 10 improvement measures, or to see how you are sitting against those measures. That's just 2 examples. The second one is the CVD assessment. So how many people have the risk factor recorded, how many don't. And because the 10 improvement measures are all about proportion, you can just switch to show percentage and it will show you the proportion there. And there's also an aggregate summary report showing exactly that. So type 1 diabetes with HbA1c recorded in the last 12 months and not recorded. Gives you the breakdown there. So a very quick way of seeing where you sit at your practice. But as I said, you might not be getting that depending a bit on your PHN. This you already have, unless you haven't updated CAT for several months. So we released this in July. And because those 3 immunization improvement measures, they require a 15-month date range, so they don't want to look at the last 12 months or the current year as we used to report, but they actually want to look at if anyone had an immunization, a flu vax or influenza vaccination in the last 15 months. So we added influenza to the reports that are affected by this particular report, and we added a pre-coded 15-month date range there. And I will show you that in a moment. So just a bit more on the actual quality improvement activities, because that part, the submitting your data set, is only one part of the PIP-QI conditions or compliance. Second part is that you have to basically prove that you're doing formal quality improvement activities at your practice. And a lot of people use the PDSA methodology. There's others around, but I don't think it matters which one it is, as long as it is formal, because potentially you can get audited if there's something there. So it's not enough to just say we're interested in, you know, getting everyone their blood pressure done. You need to actually have a formal approach to that. And there's just some examples here which you can do using CAT4 at the moment. Emergency contact in the patient record, for example, it will show you who has got that recorded and who doesn't, and you could pick that as a quality improvement activity. We do have a whole report called the data quality report, and also there's another one, the cleansing CAT report, where you can look at your data in general, but you can also apply filters, and I'll show you that once we jump into CAT4 directly. Clinical measures. Now, we've already talked about diabetes and HbA1c, so that is one of the direct 10 of the 10 improvement measures, but your quality improvement measures, and that's important too, are not restricted to those 10. You can pick, you know, the emergency contact is not one of the 10 measures listed, so it doesn't matter what it is, as long as you do formal quality improvement, that is good enough. And so, yes, you could pick diabetes and HbA1c, and that way you would also, of course, you know, sort of work towards getting good numbers in your one of the 10 improvement measures directly. But yeah, coronary heart disease and blood pressure. Do the patients get their blood pressures done on time? EGFR and diabetes, and so on. There's lots of clinical measures that you could choose, but you could also think about not just about data completeness. So do people get their checkup on time, but also what is the result? Yeah, who had a high blood pressure? How many? What's the percentage of our patients at risk with high blood pressure or BMI or whatever it is? And you could, you know, your quality improvement activity could be working towards that, lowering the blood pressure of patients. There's different challenges with all of these, but ultimately it is about, you know, defining something that your practice wants to work to improve, and there's so many options. I'll stop making bring up examples. The PHNs are in a very good position to assist you with that. Depending on where you're calling in, you might already have experience working with them, but they have done a huge amount of work around quality improvement in general. So it's really, yeah, give them a call. I'm sure they're happy to help. That is really part of their role to assist practices in this area. Okay, a couple of frequently asked questions. So I've done this presentation over the last 2 months quite a bit, and these were really the questions people wanted to know mostly, but we do have time at the end if you have more specific questions, or you can type them in at any time. But so firstly, if you don't have CAT4 installed already, I would guess people here today probably have that already done, but you might want to put it on additional machines. You can contact our support desk. If you don't have it at all, then the first port of call would be your PHN, because you need to sort out a license for CAT4, and the PHN will help you with that. And then the next step would be to book an appointment to install CAT. And because of the mapping that I mentioned, once it is installed, you still have the mapping and exercise to go through, which is where the Medtech support desk can help you with getting all the clinical details mapped correctly. Everything I will show you today is available now. So with the exception of those, the summary report and those graphs around the 10 improvement measures, so they are going to be released this month. I don't have a date exactly. These two questions, the security and the identification, I guess they go together a bit, but so firstly, the data with patient names and other details like phone numbers and Medicare numbers and so on does not leave your practice. Your own practice computer security is obviously something you need to be concerned about, but our tools do not send identifiable data outside your practice. So the process, as I mentioned earlier, is first to de-identify the data set and then upload. And in that process, we remove everything but the age in years, the gender, and the indigenous status. Yeah, so of your patients, the only thing that will be uploaded is female patient, age 39, non-indigenous. That's it. No address, no phone number, no Medicare card number, none of that. And in terms of the security of the upload, so this is uploaded using HTTPS, the same encrypted channel that your banking and online shopping uses. So you probably can never exclude that it's 100% secure, but as far as I believe, it is still considered as fairly secure. Yeah. So that's then the upload process, and remember, it is only de-identified data that is uploaded. Now, how do we know if our data is reliable? So there's a lot to talk about this one, but first step here would be the mapping. So has your mapping been done across all of the relevant indicators or everything that you can map? So that will be the first step. Secondly, we only extract information that is coded, information that is entered into the relevant field. Like, for example, we don't pull out a blood pressure from a progress note where it's been entered in free text. Yeah, that's not going to work. So if you find that your report in CAT4 shows you a lot less people with blood pressures than you would expect, you can always go back from the CAT report. You can see who the patients are, and you say, well, this patient name, I know this person, he or she was here yesterday, the blood pressure was done. Well, jump into Medtech, look at the patient's record and see where the blood pressure is. And as I said, it could be a mapping thing. It could also be that the blood pressure was entered in the wrong location in the patient's record. So as a basic rule, we look at the field, like not free text in general, and we certainly don't look at free text or free coded diagnosis. This is one other thing that might come up, and this is, I'm not 100% sure how Medtech deals with that, but for some of the pathology tests, and particularly the cancer screening, such as mammogram and the HPV or cervical screening now, we do rely on the test name being in a list, and I'll show you that in a moment where you can cross-check, because the labs are not using the same names across the country, unfortunately, so there's a bit of variation there, and particularly with a new test like the cervical screening now, or comparatively new, the list is growing already, and I'll show you an example for that. But just some resources, and I'll show you those websites in a moment. The slides are available. I've sent them to Medtech, so they will send that out, I believe, in the email to the participants. So let's jump out of this, and we'll have a look at the resources that I mentioned. So that's our webinar. So firstly, starting point would be our help site. And you can see the products there for you. Relevant is the CAT4 in particular. And the one thing I wanted to show you there is the mapping that I just mentioned. So, and I'll just show you the general pathology just as an example for that. Yeah, so we do have the test names in there, but that's something that the mapping will take care of. And like I said, with the way Medtech maps it, I'm not even sure if these are relevant, but for the other systems, just to show you that as an example, this is the list of cervical screening test names that we pick up. Last month, we only had these because these 3 were added because some people across the country reported our test names are called CST text, for example. So it's a bit annoying to be constantly trying to find what kind of names do the labs come up with, but ultimately that's what we do. And you can see the PAPS method obviously is a test that was used for much longer. The list of names there is very long, and there's some rather odd ones like these 2 in there. But yeah, you can check this, as I said, in terms of validating your data as well to see maybe that could be a problem, that there's a test name used that we're not familiar with. Second thing I want to show you are the recipes. There is also a link directly. So again, I assume everyone is familiar with CAT4, at least to a degree. When you log on, you do have those links here, and that is the recipe link. The user documentation just gets you to the main page. But the recipes, and there's lots of different ones, so there's step-by-step guides, but the one here, that's the new last chapter here, the PIP-QI improvement measures. So each of the 10 measures has a step-by-step guide to get you through basically what to do. If I go into here, for example, the COPD patients, we've got the rationale there. Why is it done? Who's the target population? And then how to actually do it. So you got your starting screen, you go to the general tab, age 15, active patients, condition COPD, date range 15 months, and then you have the report, and that will give you, so in my case, 19.8% is the proportion of COPD patients older than 15 with nothing recorded. Very, very straightforward, and I think that's probably, I'll give you some more examples when we actually look at CAT directly. And I also want to plug our webinars here. So we do talk a lot about PIP-QI at the moment because there's a lot of interest, and this is relevant for all CAT users, so it doesn't matter if you're using Medtech or another system. So this is just improvement measures for patients with diabetes. And then we have our general CAT4 and top bar sessions. We used to do them weekly, but it's just with all that PIP-QI interest at the moment, we put them a bit on the back burner. But there are also videos. So this is vimeo.com/PenCS, and I'm just going into the call it showcases, but you can see there are categories there. The one I wanted to highlight is the practice webinars. These are all topical videos. One particular area, like recall CAT, data quality, of course, very relevant in the context of PIP-QI. CAT Plus prompts, only for top bar users, so that wouldn't be relevant for you, but have a look at these. I think on page 2, I have a similar presentation to what I'm talking about today, CAT Plus and PIP-QI. But yeah, so that's certainly something where you can, and if you're really keen, let me just go back. There's a series of webinars for the West Australian PHN. You can graduate from CAT4 for beginners to intermediate to advanced if you have 3 hours to spend and really want to listen to me for 3 hours. But anyway, it's there. So the resources hopefully will help you with that. But let's go into CAT now. And I'm going to be in the CAT4 view, which gives me a full range of all reports, just to be able to jump around. There's other ways you could just look at a reduced set of reports, but generally speaking, that's probably the way to go. And normally you would always, of course, load the latest extract here, but you can see the number in the middle is the number of patients in there. So in this case, I'm just loading our demo data with about 8,000 patients there. So before we get into the CAT functionality, I wanted to show you the upload process. Yeah. So my data here is already de-identified. Let me just delete this one. Right click on it, can delete. So this is my 72 patients in here. And you could not upload that. The process to upload is a right click. Sorry, you don't even get that. Interesting. So you get that send to in here, and you get that send to only when it's a de-identified data extract. And to do that is you select the extract, you go to tools and click on de-identified data set. You're about to de-identify. It's a quick process, even if it's a large extract. And here we go, we got 71 people there. Now, why would there be a difference between the full extract that you have in your practice? And just to show you the difference there, so if I look at my normal extract, and this is just for my demo system, so they get patient names and the date of birth and all of that. If I go to the de-identified extract with the 71 people, first you get an error message because the link file which contains those patient names and so on is missing. And you can see, as I said earlier, gender, age in years, that's all that's left in there. This report doesn't show ethnicity, but that's also there, but there's nothing else in there. So why is there one person missing? And the reason for that is that we have a patient that has opted out of sharing the data. So this is part of the PIP-QI compliance requirements that you need to be able to, if a patient wants to opt out, and this is out of the de-identified data sharing, mind you need to be able to do that. And it is on our help site. If you type in patient consent, sorry, it's just going to load, you will get the detailed instructions, but I'll just very quickly show you how that's working, because that is a common question in sort of people say, how do we manage that? So let's say you know that someone in here, and that's the person that wants to opt out. There's a add withdraw patient consent icon down here, and you get the list of all of your patients, and you can just select the person that wants to opt out and click on OK, and that's it. So what that will change is in your reporting at the clinic, nothing changes, but as soon as you de-identify the data and upload it, this person will not be included in the de-identified extract and thus won't be uploaded and shared. Yeah, so that's the principle there. Have a read on the website first about how to correctly set that up and how to apply it, because it's important that the paths and everything is configured correctly, but ultimately that's the process there to provide an opt-out option for patients. So let's assume everyone's in there. No one has opted out, and we going to have a look at some of the examples for quality improvement and those 10 improvement measures, of course, as well. So I already showed you the one with the COPD and immunization. So we'll do something else, and this is similar to what James was talking about. We want to look at, and the definition there is always active patients. There are 3 visits in 2 years. That's what the Department of Health has defined for the quality improvement measures there. And in this case, we want to look at diabetics. Now, they are not interested in undefined diabetics. And again, I'm not 100% sure if that's even a possibility in Medtech. It certainly is in the other clinical systems where you can put a coded diagnosis in, but it's not clear if the patient has type 1 or type 2 diabetes. So the Department of Health is not interested in this sort of undefined, unclear diabetic status. So what we need to do is click type 1 or type 2, that you get only those patients with the either type 2 or type 1 diabetes diagnosis. And you can see there's 323, you can see the age breakdown and so on, but what we're interested in is their blood pressure in this case. So that is I think it's number 10 of the quality improvement measures, and you find it under measures and BP, and you can see a breakdown here. And again, as I mentioned earlier, the show percentage will give you the proportional percentage rather than the numbers. However, there's one important thing missing, and that's the definition in the quality improvement measure. It says in the last 6 months. So they define a current blood pressure as in the last 6 months, and that's where the date range result filter comes in. If you don't use that filter, let me just show you what that means. You can export and you can see the results, and you can also see the date in here. And so you can see this person, yes, they have diabetes. Yes, they're an active patient, so they had 3 visits in the last 2 years. Their last blood pressure was done more than 6 years ago, more than 5 years ago, more than 5 years ago, and so on. So these are obviously not current by the definition of the Department of Health or anyone else's really. So the way to do this correctly, date range result filter, diabetes type 1 or type 2, and active patients. And you can see it's changed quite a bit now. We have actually 32% that have nothing recorded, because anyone outside the 6-month period is now included in the not recorded. And that answers, so that's basically the step through of quality improvement measure number 10. Regular patients with diabetes type 1 or type 2 with a current blood pressure recorded, and that in this case it's 50, what's the number? I'll have to do some maths in my head there. It's 67.8. I think that's what it is. 67.8% are up to date, but 32.2% are not. Yeah, so there's certainly something that you could pick as a quality improvement measure, because let me just show you an example for something else. Smoking is another thing that is relevant in the, just got to clear my filters again, because the smoking is not just for the diabetics in there. And you can see this particular clinic, they're doing really well. Only 5% have nothing recorded in their smoking. So it's a lot harder to go from 95% to 100% than it is from 60 something percent up to 70 or 80%. Yeah, so pick wisely what you want to choose for a quality improvement measure, rather than the hard cases like where you're already doing very well. Maybe focus on others. And that gets me nicely, I've got 4 minutes left, deep breath, to the data quality report. So this one shows you and you might already know that it's been around for quite a while, and it is not related to PIP-QI. It is related, however, to accreditation. And of course, the ACPAL and the RCGP were involved in this whole PIP-QI design. So there's quite a bit of overlap between what is required for accreditation and what the PIP-QI improvement measures are looking at. So you can see our first tab here. It's really very rough to give you an idea what are the areas where we're doing well and other areas where we could improve. And you can see the only one with the green tick is the medical history here. The cutoff is 75%, so it's just above. And then there's obviously others in orange and red. But the real interesting report is the second one, because that breaks it down into details. Just keep in mind the report here is pre-filtered. Eligible population is people with 3 visits in 2 years, so that's exactly the same denominator that we need for PIP-QI, but also for accreditation. So again, you can see 92% have an allergy status recorded. So that is not so easy to improve. Medical history, like coded diagnosis, 75% is sort of quite good, but easier. And again, now that we're looking at just the active patients, before it was everyone, it's nearly 98% with the smoking status there. But on the other hand, only 24% have a waist circumference recorded. So that could be one way of planning your quality activity by looking at these. And it's kind of a win-win. You improving your data for accreditation, and you meeting the formal quality improvement activity for PIP-QI by picking one of these. So that's just one way of looking at it. And I just wanted to show you how you can combine this with a filter. So you could argue, for example, if we want to improve this and you put something in place, like a new workflow where you're asking for additional information at reception, for example, like the emergency contact, or if you're looking at allergy statuses or smoking, whatever it is. When you introduce that new workflow, so you got a baseline. This is what we're starting. This is what we base our quality improvement activity on. And we're going to run this for the next 3 months or 6 months, whatever it is. And this is the outcome we expect. Now, you will probably get monthly CAT data to check how you're going. But what you can do is you can use a filter here, and there's different approaches, but you could say, I only want to look at people that have actually visited either in the last 6 months, or you pick your own date range. Just remember the end date range is always the date of the extract. It can't be, that's when we took the snapshot of the data, so you can't go beyond that. So if you only introduced that in the last, whatever, like say since the 1st of April, that's the date range you want to look at in terms of visits. Now, what this report will show is all your active patients, so they all had 3 visits in the last 2 years, and all of these have visited in the last, or in those 2 months prior to the extract. And that gives you an idea of, is there any difference in these people's records? So for example, they're slightly better with the 76% and 75%, so there's a little bit more coding going on. The waist circumference was at 24%. People that have visited in the last 2 months are at 35%. Yeah, so that, and I don't know if this practice does anything around waist circumference, but this is a way of seeing changes in people that actually have come to the practice. You can't, if you look at everyone, that's one way of looking at where you overall how you're doing. But ultimately, if you want to enter a waist circumference, the patient has to visit the practice, and if that's not the case, you can't enter it. But in this case, we know they have visited, and we can see an improvement in that measure. And I'll want to be on time, so I'll stop now, and we're open up for question. Or back to you, Karen.
Oh, thanks so much for that. Really appreciate it. Now, James, are you still there? Let me unmute you. Oh, no sound.
Yeah, James is here.
Oh, hi, James, and Ben's still there.
Yep.
Yep. Fantastic. Well, we don't have too many questions. The first one is, once this gets extracted, how do PHN collect it? Which I think you've probably answered that with your presentation, Matthias.
I think I forgot to show the upload process after all that. I talked about the de-identifying. So let me quickly show you how that's done. So basically, you need to de-identify the data, and then the next step is a right-click on the extract, send to, and you can see there are 2 listed here. In most practices would only have one PHN listed. Whoever is the license holder, whoever actually arranged that you can use the tool, that will be listed there, and then you just click on it. And let me show you, I'll do it with a smaller data set. If I go to send to, and I send it to this clinic here, you're about to send the data, and you click on yes, and that's it. Now my file is very small with only 70 patients. If you have 20,000 patients or whatever, this probably will take, depending on your internet speed, but it might take 10 minutes, 20 minutes at max. I probably would do it, as James said, with the extract as well. Try to do it at the end of the day or after hours to not impact on your internet connection during the day or whatever. But that's basically the upload process. So right click and then send to, and you will see your PHN listed in there.
Okay, thanks for that. And then one other one, don't forget folks, if you have any questions, please send them through. This one is for you, Ben and James. PenCat was installed on my system, but we only have 10.4.3. Will it not work with 10.4.3?
Yeah, so thanks for that, Karen. I could probably put some clarity towards that. It's just that we have a recommended process that we would like all our clients to be up at our latest functional platform in 10.4.4 or 10.4.5, but we do have assist enhancement that our support teams can help and install it on the 10.4.3 platform.
Okay, thanks for that. Now, so no other questions have come in. Did you have anything else you wanted to share with us, James or Ben, that the clients need to know? Oh.
Well, it's online now and totally available, so they can download the extraction tool. And if they have any questions, they know our support line. They can give us a call and speak to our support. And same thing with, like Matthias said, they can call up Penn and get help with it as well on their side. So yeah, if you have any problems either installing it or configuring it or running it, yeah, just give us a call. We'll be happy to help.
Okay, thanks for that, Ben. We've got one that's come in. In Medtech, how do I record correctly, i.e. BP? I guess that's blood pressure.
Pretty simple. So inside your patient manager is your screening terms. At the top left-hand side of your screening term window, there's an action screen or a little green plus. With the green plus, you can click that and then select your screening, and it will show you blood pressure. From that, then you can type in diastolic and systolic measurements. And we can also give you some training, Robin, if you'd like us to show you how to do that.
Okay, thanks for that. The next one is, so we collect the data in Medtech PenCat, but then do we have to another site to upload to PHN? Is Medtech PenCat separate to Cat4? Yes, Ben.
It's a bit of a split one, this one. So the Medcat system is separate. Medtech is pulling the data out in a raw format, which is XML, and then it's going into PenCat. So we're just taking the data out and we're creating it correctly, taking our screening terms out, mapping it to the required data sets that PenCat wants, and then PenCat opens it inside their systems, and then they go from that. Yes, correct. They are programs.
Okay, any other questions from our audience? Two separate programs, yes, Barbara.
Yes,
two
correct.
Separate programs.
Yep.
Yes, I think that's it. If you have any other questions, as Ben said, please contact support and we'll be able to point you in the right direction or answer the question straight away. I hope you've got a lot out of today's session. We'll be holding these sessions regularly on different topics. This was just the first of many. So thank you so much for your time. Thank you, Ben and James and Matthias. And we'll see you all next time.
Thank you, guys.
Thanks, everyone. Goodbye.
Bye.
Bye.
Bye.